Assalamu alaikum. I am Dr. Asma Hosna, Associate Professor, Department of Pathology, Bashundhara Ad-din Medical College. Dear students, welcome to your today's pathology session. Today I am going to discuss the topics about aplastic anemia. At first, the aplastic means hypoplastic, so it is also called hypoplastic anemia. So aplastic or hypoplastic anemia is defined as pancytopenia resulting from aplasia of bone marrow. In our previous classes, I have already discussed about the pancytopenia. So you know that the pancytopenia is the condition which is referred as simultaneous presence of anemia, leukopenia and thrombocytopenia. And so it is classified into two categories. One is primary aplastic anemia, another one is secondary aplastic anemia. The primary aplastic anemia may be congenital or idiopathic, acquired, and the secondary to ionizing radiation, drugs, chemicals and viruses. What about the pathogenesis of aplastic anemia? It mainly occurs due to reduction of number of hematopoietic stem cells and also for faulty in remaining stem cells or an immune reaction against them, so that there is unable to divide and differentiate sufficiently to populate the bone marrow. What are the causes of aplastic anemia? In primary cause, it includes congenital, that is Fanconi and non-Fanconi types, and idiopathic acquired. And in secondary aplastic anemia, it includes ionizing radiation, that means accidental exposure like radiotherapy, radioactive isotopes, nuclear power station. And the chemicals include benzene, organophosphates and other organic solvents, DDT, and the pesticides, organochlorines and recreational drugs. And the drugs include those that are regularly causes marrow depression, and these drugs included busulfan, melphalan, cyclophosphamide, anthracycline and nitrosoureas. And those that occasionally or rarely causes marrow depression like chloramphenicol, sulfonamide, gold, anti-inflammatory, anti-thyroid, psychotropic, anticonvulsant and antidepressant drug. And the viruses include viral hepatitis and Epstein-Barr virus. Now, what about the clinical features of aplastic anemia? At first, the onset, the peak age is around the 35 years and the male predominance is present. And the clinical features may be insidious or acute with sign symptom resulting from pancytopenia. So patient may present with sign symptom of anemia, and patient also may suffer for repeated infection in the mouth and throat, and also bleeding like bruising, bleeding gum, epistaxis and menorrhagia. But in aplastic anemia, the lymph node, liver and the spleen are not enlarged. What are the laboratory findings of aplastic anemia? At first, we will see the peripheral blood film. So, we can get normocytic, normochromic or macrocytic anemia, and the reticulocyte count is extremely low in relation to the degree of other anemia. And the WBC count, we will get leukopenia. There is a selective fall in granulocyte which is about 1.5 into 10 to the power 9 per liter. And the severe cases lymphocyte count is also low. And in platelet, we will get thrombocytopenia in the severe case, which is about 20 into 10 to the power 9 per liter. And there is no abnormal cell in the peripheral blood film. If we do the bone marrow, we will see there is hypoplasia of the bone marrow with loss of hematopoietic tissue, and there is replacement of the fat about 75% of the marrow. And in prefined biopsy is essential for aplastic anemia, and in prefined biopsy we will get patchy cellular areas in a hypocellular background. and the main cells are lymphocytes and plasma cell, and the megakaryocyte is severely reduced or absent, and the iron content is normal or low. And in severe cases of aplastic anemia, we will get neutrophil less than 5 into 10 to the power 9 per liter, and very severe cases we can get less than 2 into 10 to the power 9 per liter, and the platelet count is reduced, that is less than 20 into 10 to the power 9 per liter. Reticulocyte count is less than 2 10 to the power 9 per liter, and the marrow cellularity also is less than 25%. This is the picture showing the trephine biopsy of a bone marrow. So, come to our next topic, that is hemolytic anemia. First, you have to know what is hemolysis. If there is an increased rate of RBC destruction with shortening of RBC lifespan, is called hemolysis, and the normal RBC lifespan is about 100 to 120 days. And the hemolytic anemia are a group of disorder which is characterized by increased RBC destruction, while the bone marrow compensating for hemolysis by increased erythropoiesis. What about the pathogenesis of hemolytic anemia? There are premature destruction of the RBC which may result from intercorpuscular abnormality of the RBC, and so the fault lies in RBC itself and render them more susceptible to normal mechanism of red cell destruction, and also extracorpuscular or extrinsic abnormality. In these cases, hemolysis occur due to development of abnormal hemolytic mechanism, that is immune and non-immune mechanism. What about the normal red cell destruction? Normally, the red cell destruction occurs after a lifespan that is 120 days, which is removed by extravascular by the macrophage of the reticuloendothelial system, and especially in the bone marrow, and also occur in the liver and the spleen. The breakdown of the heme from the red cell, it liberates iron for reticular recirculation via plasma transferrin mainly to the marrow for erythroblast, and also protoporphyrin, which is broken down to bilirubin. The bilirubin circulates to the liver, where it is conjugated with glucuronides, and when it is conjugated with the glucuronides, it can excrete it into the duodenum via bile and converted to stercobilinogen to stercobilin, and which also excreted in the feces. And this stercobilinogen and stercobilin are partly reabsorbed. So when it is reabsorbed, that also can excreted in the urine as urobilinogen and urobilin. And the globin chains are broken down to amino acids, so which also reutilized for generation of the protein synthesis in our body. And the haptoglobins are protein that present in normal plasma and which are capable of binding of hemoglobin. And the hemoglobin haptoglobin complex is removed from the plasma by the reticuloendothelial system. So my dear students, that's all about today's lecture classes. Inshallah, see you again in our next class. Till then, Allah Hafiz.